With the new year upon us, we thought it would be a good idea to talk about one of the biggest projects moving forward in Niagara over the next little while. That is, of course, the building of the new South Niagara Hospital in Niagara Falls. Niagara Health's Chief Planning Officer Cliff Harvey joins us. Cliff, back in early December, an announcement at the City Council meeting that the price tag has jumped for this project. What was the cost for that jump?
I can't get into the details right now. I will say that once we sign the contract, which is expected later in February, we'll be able to announce the contract price for the project. But I'll say it was expected that the price would go up because with the inflation escalation and the pressure on the market, we were prepared for that. And so as we move through the approval process, we've been working with the government to get that approved.
Projects of this size often will have cost overruns because they do start to get estimated at one point, and really the shovels don't go into the ground until often years later.
$2.5 million.
That's true. Now, I do want to clarify, cost overruns often think that people have control of the budget and they've let the project get out of control. This is actually responding to the market. And we all appreciate that through COVID, the escalation in the market has gone up. There's pressure now on the workforce in terms of finding skilled trades. So this was expected as we went through. We've constantly revised and looked at the budget. So we've been aware of this. I'm sensitive to that because part of my role and responsibility is to make sure there is no cost overrun at the end of the day. So at the end of the day, I would say we're on budget because we had to revise the budget.
When you look at a project of this size, 1.3 million square feet, is it 470 beds? None of that will have to be scaled back to meet some of these financial demands, will it?
No, that's one thing that we discussed with the ministry starting at the release of the RFP. The pressure on the project had started even back in October of 21 when we released the RFP. And the discussions with the ministry was the fact is that Niagara needs all these services. This is not an area where we would cut. I will say Niagara Health and the redevelopment team did an excellent job of value engineering going into the RFP release. And that helped us actually meet the budget that was set by the government. At the same time, make sure that we got all the services and clinical programs that Niagara Health and Niagara Region needs.
This announcement that's coming up in February, when exactly can we expect that? And that is basically the announcement about who will be building this project?
Yes, in one sense. In December, we announced the preferred proponent. So the exercise that we go through is we closed the RFP in August, of which we had 2 successful bidders. We did the evaluation. We went through the negotiations with the first-ranked bidder. And then in December, we announced Ellis Don Infrastructure Healthcare as a preferred proponent. So we do know that that's the person that or the company, I should say, that we're expecting to sign the contract with. And we're in the closing process now, which is quite an extensive work to actually set up the contract to be signed in February. So we do know if we're successful in the final parts of the closing of the negotiations, it will be Ellis Don Infrastructure Healthcare, and that will be the company that will be building the new hospital.
When are we aiming for shovels in the ground?
We expect to see work on the site starting this summer. It'll take a little bit of time because this is a design, build, finance, and maintain project. So we'll be designing it as we meet with the project co, as it's called, to go through that exercise. There's about 6 months of work there, but then they'll start doing work on the site, including site trailers. So this summer we'll see activity. I'll say, we should have a shovel in the ground sometime in July.
And the finish date for the whole project, best possible date?
Right now, the best possible date, which is always set by the bidders when they put in their submission, is probably in the second quarter of 2028. So sometime, I will say, summer of 2028.
Cliff, thanks so much for the update, and I'm sure we'll be checking in with you later on in 2023.
Oh, great. Thank you for the opportunity to speak. Bye now.